Good morning, everyone. Today we're going to talk a little bit about A1c. If you've got an A1c of 6.5, but your average blood sugar is, say, 180, is that a good thing or not? We're going to talk about that in just a minute.
Let's just take a few minutes and talk about A1c. A1c measures in percentage points the amount of sugar that's attached to the oxygen-carrying hemoglobin of the red blood cell. If that's a small amount, then the A1c will be low. If there's a large amount, then the A1c will be elevated. One can estimate the average blood sugar or glucose by looking at the A1c. So an A1c of about 7 is about 154 mg/dl or about 8.6 millimole. The normal lifespan of a red blood cell is about 90 days. The percentage of sugar attachment to the red blood cell can give an estimate of the average blood sugar for that 90 days. Several pivotal studies have shown that A1c levels in the range of 6 to 7% is associated with reduced complications in patients with diabetes. Therefore, A1c is considered the gold standard in estimating diabetes control. What are the advantages? It provides an estimate of the average blood glucose over the past 90 or so days. It can be done from a finger stick in your health professional's office. What are the disadvantages? Well, if the sugar is sometimes very high and sometimes very low, A1c may be in the good range. For instance, if this was a patient's blood sugars, they range all the way from 40 to 300, but the average is 153, which equates to an A1c of about 7%. A1c can be falsely elevated. It can be falsely elevated if anything causes red blood cells to survive longer than the expected time. Falsely elevated A1c can be caused by iron deficiency anemia. We've actually seen it in some people who were just taking iron but not anemic. Vitamin B12 and folate deficiency anemias, and the absence of the spleen, chronic use of opioids, aspirin, or vitamin C can also cause falsely elevated A1c. How about low A1c? A1c can be falsely low if anything causes the cells to have a shorter lifespan than is expected. Such things as sickle cell trait. Actually, we've seen falsely elevated and falsely low A1c in sickle cell trait. Pregnancy, recent blood transfusions, chronic blood loss, enlarged spleen, vitamin E. So what do we use in addition to the A1c in order to estimate the diabetes control? Fingerstick blood sugar determinations, but we are not able to get patients to test as often as we would like. Continuous glucose monitoring is going to replace A1c as the gold standard in our opinion. Fructosamine measures the amount of sugar attached to the protein. Glycomark is a blood test that indicates good glucose control if it is high and not so good if it is low. Not used as much, but we're starting to use it even more. Random blood sugar at your health professional's office is good, but it only tells you what the blood sugar is right here, right now. Thank you very much for listening. Please see our website at www.diabetescontrolsc.com.